Oh, g'day, Phil McCracken. What's cracking, Lappin?
Hey, g'day, Doc.
How you doing?
Thanks for coming out.
Yeah, no worries.
Well, these are my problem cows. Yeah, I got them around 10 days ago from a nearby property.
Okay.
And I saw, well, that rain just brought some really nice, lush grass.
Nice.
So I've put them there, and yeah, that's what's happening.
Okay.
Definitely not looking well.
No, what's going
Yeah,
on?
so this one has been, I've been noticing a bit of difficulty breathing.
Yeah.
Move along.
Ooh,
Yeah, you
what's
see that white stuff
yeah,
coming out?
Yeah.
That's not normal, right?
No, that's
Yeah.
not normal.
Honey, don't forget the fat belly one. Hi.
Oh, thanks, honey. I love you too. So yeah, as my wife said,
Yeah.
this also looks bloated. Hey.
Yeah, it sure does. That's
Yeah.
for sure. Yeah.
So, what do you think?
Well, there's a couple things going on. I'll just get my stethoscope, okay? I'll be right back.
All right.
Yeah. Hey boss, sorry to interrupt you.
What is it?
Yeah, sorry, I just have a few sick cows that I need to talk through with you. I have no idea what's going on.
Alright, well give me your problem list.
The farmer said some of them were dyspneic and polypneic, and also one of them had some frothy nasal discharge. It was weird. And oh yeah, there's one with bloat.
So, let's think of the possible differential diagnoses here.
The main diseases I was thinking of was bovine ephemeral fever, bovine malignant catarrhal fever, tick fever, possibly bloat, infectious bovine rhinotracheitis is also a possibility, bronchopneumonia, cardiac problem, could be, you never know. Yeah, so, I don't know, what do you think is most likely here?
Well, that's for me to know and you to find out.
Well, she was bloody helpful. Well, I remember back in TILHAPS we did something like a decision tree or something, so I might try that. The infectious decision tree. Let's see what we have here. So these cows all showed signs of respiratory distress, which are very nonspecific, as well as depression. However, if I did see cows with lameness, limb stiffness, or pain, I would be tempted to think of bovine ephemeral fever. That could be likely. Also, if I saw lymphatomegaly, keratoconjunctivitis, hemorrhagic diarrhea, or hematuria, I would be tempted with bovine malignant catarrhal fever. Definitely a possibility. Ooh, IBR, yes, that is a strong contender. These cows would show pyrexia, anorexia, necrotic plaques, short explosive cough, which we didn't notice this morning, but I'll give a closer look, and also possibly nasal discharge. Yep, definitely. Oh, and last but not least is bovine respiratory disease complex. So this could happen subsequent to an IBR infection, and they would show serous oculonasal discharge, a stiff gait as well, interesting, crusty muzzle, mild diarrhea, possibly some soft coughing. Okay, these are all possibilities. Let's keep them on the list, and let's see what the parasite tree has for us next. Okay, so here we have the parasite decision tree. Tick fever, of course. That would explain the depression we saw. However, the cows would also have pyrexia, neuroscience, dark-colored urine, anorexia, anemia, and reluctance to move. So we'll have to check that out during the clinical exam. Oh, and I'll have to check for ticks as well. Okay, what's next? Okay, now the metabolic decision tree. Let's see. Oh, yeah, bloat. Yes, that was what that farmer's wife was saying, the fat belly. Okay, so yep, that would explain the left flank distension, the dyspnea, but they would also present typically with sudden death. We could have caught it before it got too bad, grunting, and polyuria, so we'll check that out. The cardiac decision tree. I almost forgot. How could I? Let's see what we have. Yep, traumatic reticular pericarditis. Could be a possibility. So I would have to check for muffled lung sounds and muffled heart sounds on auscultation. And they would probably present with signs of heart failure, such as jugular vein distension, submandibular brisket edema, and ventricular arrhythmias. But would it really cause a herd-based disease? I feel like it would, maybe affect an individual, maybe two cows. Oh, but if we had cardiac glycoside toxicity, that could cause acute subacute heart failure in the whole herd. Okay, maybe a farm walk would be in order to, look for toxic plants.
Why is she talking to the tree? She crazy?
Honey, that vet is crazy talking to a tree. I recommend neighbor psychic Mystic Wheeze. So much better.
Mystic Wheeze. What does that even mean?
Welcome.
Oh, hello.
You must be here to meet Mystic Wheeze.
Yeah.
Follow me.
What is all this
She's
crap?
in here.
Oh, okay, I'm liking this.
Just follow me.
Oh, damn. There's a bonfire going on here.
Now you sit down here.
Okay.
Mystic Wheeze won't be a boat.
Alright. Better be quick to them all day.
Hello.
Oh, God.
I am Mystic Wheeze. What brings you here, Phil?
Well, my cows, they've been,
Sick?
Yep. And I'm here to...
You want me to speak to the cows that have passed before them to see their pathology, Phil?
Sure, if that works.
Yes, we shall.
Alright.
You must hum with me to summon the spirits, Phil.
Ooh, you're touching my hand.
Hum with me. Did you sense the spirits, Phil?
Nope, you're still
Keep
touching.
humming. The spirit is here. I'm going to have to use the tarot cards to identify a specific disease.
Alright.
R-I-B.
Riffs, I love riffs!
Something is not right. IBR. Infectious bovine rhinotracheosis, Phil. I'm sensing I have some inflamed nares with clusters of necrotic foci in my mucous membranes. I have pseudo-diphtheritic yellowish
Toothpaste.
plaques. They're plaques, Phil. I have some petechial ecchymotic hemorrhages in my nasal mucous membranes. Oh, very zero fibrinous exudate. It is everywhere. Oh, I'm sensing some areas of focal necrosis in my larynx, and they're coalescing to form some greyish plaques. The plaques are back, Phil. My pharyngeal and pulmonary lymph nodes are acutely swollen and hemorrhagic. It's extending. I have locally extensive, severe, subacute, necrotizing tracheitis. It's spreading. I think there's something else here.
There's something else.
Another spirit. It's coming. I have some bilateral, subacute, locally extensive, severe cranioventral bronchopneumonia. Can you feel the cranioventral consolidation in my lung lobes, Phil?
Very
Can you feel them? I'm seeing red. I'm seeing red. It's inflammation. It's congestion. It's atelectasis in my lungs, Phil. The bronchopneumonia.
Something's on her face.
It's intrabronchial purulent mucopurulent exudate. It's coming from the lungs, Phil.
That's her face.
What is that smell?
I farted, sorry.
Can you feel the firm lumps
yeah.
and abscesses in my lungs? This bronchopneumonia, leave us now! Leave! Let's see if there are other spirits in the room with us. I'm sensing a presence. It's a strong presence.
Ooh, how strong?
I'm going to take the tarot cards, Phil.
Okay.
Come, Phil. Let's see who is with us.
It's stuck there.
We have enlarged lymph nodes, granulomatous lesions in the lung, liver, and spleen that are encapsulated.
So. What's it?
Mycobacterium bovis, I should have known.
That was full on.
I think there's one last spirit here, Phil.
Not another one.
I want to try something different. You pick a card.
This better be a good win. Oh, God!
What is it?
Bloody hell!
Show me. Death. This is bovine. malignant catarrhal fever.
Are you okay?
My eyes are swollen. I have ocular nasal discharge. Oh, my nose. Oh,
Oh my.
my respiratory and alimentary tract is necrotic. Oh, my lymph nodes are enlarged.
It's getting real.
Oh, it's spreading.
What's on your arm?
I have disseminated arteritis and phlebitis, Phil. Neurological signs. I'm on the way out. I'm going.
This has gone way too far. I better get back to the vet.
Oh, Doc, thank God you're here.
Yeah, no worries. So, Phil, my clinical exam shows that your cows are dyspneic, febrile, tachycardic, they have reduced rumen sounds, some have bloat, they have expiratory wheezes, crackles, and also have a heavy tick burden. I think the main problem is bronchopneumonia.
Oh, how did they get that?
Well, it's part of a disease known as the bovine respiratory disease complex. Stresses, such as the recent transport they just had, can compromise their immune system, and in combination with viral infection, can allow resident bacteria to colonize and cause an infection.
Oh, what kind of viruses are there?
Well, the most common ones involved in this disease complex are IBR, pestivirus, bovine respiratory syncytial virus, and parainfluenza virus.
So how do we know we have this complex for sure?
Well, we can test for IBR and the antibody test done in paired blood samples 4 weeks apart, or the IBR ELISA test, or we can do a PM if you'd be willing.
Cool. So how do we treat these deers?
Well, we can either do nothing at all and just observe them, reducing stress and providing good nutrition, or we can treat empirically for secondary bacterial infections with some anti-inflammatories and antimicrobials. We can find out exactly what bacteria is causing the problem by doing a PM and collecting lung tissue for bacterial culture.
What about all those ticks and that fat belly one?
Yeah, so we did consider tick fever as a possibility, but I think it's probably not the main thing going on since your cattle are not naive, they're from the area. But we can do a blood smear to rule it out if you'd like. I also recommend you move the steers off the lush lucerne to
stop
prevent
eating
bloat
that grass.
happening again. And I also think that we should pass a stomach tube just down this fat belly one just to, release the pressure a bit.
Well, sounds good, Doc. Let's get those tests done.
Okay.